Hi, I'm Diana Devi. Today I want to talk about hormone replacement therapy. This comes up because this week I talked to three different women who had so much misinformation about hormone therapy that I felt it's really necessary to get the word out. And it has such a significant impact on the quality of life for women who are going through perimenopause, menopause, and postmenopause. All of the feelings of feeling like it's not your body, the feelings of I'm tired, I'm gaining weight, I don't feel good, I can't think well, what is wrong with me? The brain fog, being crabby, just, little things like not being able to stand the way somebody chews at the dinner table. All of these things are associated with perimenopause, menopause, and postmenopause. So I want to talk about today is what can you do about it? What are some alternatives and help you give the tools that you need to be an advocate when you go in to talk to your healthcare professional. I cannot believe some of the stories, and I myself was one of the ones that had this happen. I was told there was nothing wrong with me. I was getting old. I needed to get used to it and stop trying to be young. I wanted to feel like my body was my own body, and I was told I was, having a difficult time accepting my aging. Well, a little bit of that was true. I mean, I had some ageism associated with it, but what was driving me to go was not that. It was because I didn't feel good. I did not feel like me. I wasn't enjoying the things that brought me such joy before. When I start not liking tango dancing, there's a problem, or we're not wanting to go. So back to the three women that I talked to this week. One of them went to her physician, and her physician said, "There's nothing wrong with you. I've done all the tests, everything as far as that goes. Um, it's all in your head." Second woman went and she was put on oral estrogen and given progesterone and said she could only have it for a couple more years because there was no data to support the fact that it actually works after that. Third woman went in and basically they said, well, your symptoms could be a lot of things. Why don't you watch what you're eating and exercise more? Now, most of us, yeah, we could watch what we eat a little bit better. Yes, we could do more exercise, but the exercise routines that we did before don't necessarily work here, nor do the diets. So just knowing that you have to change some of those things as well, but hormone replacement therapy. So recommend two at least, and possibly a third, depending upon how you feel about it as far as estradiol, using estradiol and using it as a patch. Because of the way that your body gets rid of it, if it's a tablet, it's not going to be effective for you and it's not going to help. And the dose may not even be one that works for you. So, recommendation is the patch. Now, the patch comes in two different forms. It comes in a twice a week and then a once a week. The twice a week patch is maybe this big. You put it on, and for me, it's like Monday and Thursday. I put it on Monday, leave it on until Thursday, take it off and put a new one on. So that's the twice a week patch. There is a second patch that is a week patch, and that one is about this big around. I have a sensitivity to glues and things, so that one is more irritating for me. I'm not the only one. I've talked to several other women. There's your skin changes with menopause. It becomes more sensitive. And so now I'm in an uphill battle trying to get approval through my insurance for the twice a week patches because they're tiny. I can rotate the side of where I put it on. In other words, you put it on in the belly region, down in the belly region here. Can't see it very well. Put it down in the belly region and you rotate where you put it. In other words, you don't put it in the same spot every time. The second component that you absolutely need if you're going to have the estrogen is progesterone. That is the micronized version. It's one that you take at night before you go to bed. It helps tremendously with sleep for most women. So those are the two things that I recommend. The third one is testosterone. It's not as widely accepted as using the other two, um, but it is something that if you're tested and your testosterone level is low, you can look at supplementing. Testosterone in women, we actually have testosterone. Testosterone is associated with muscles and being able to build and keep muscles, which as we get older, we lose 8 to 10% per decade, and it accelerates during menopause. So we want to, and perimenopause. So we want to do the things that we need to do. Testosterone isn't the only thing you're going to do. You only need to do some weight training. I have another video where I have my weighted vest that I'm wearing it. That's one way aside from doing some heavier weights. So just to kind of review again, estradiol patches, progesterone capsules that you take, and perhaps testosterone. And my recommendation is go to your physician and talk to them about these. If you are written off as this is all in your head and there is something wrong with you, aside from you needing support through this hormone change, you need to find another doctor, my opinion. Because if they're not listening to you on this, they're not listening to you on something else that is really important. And after all of this are pieces of the puzzle that you put together because hormone therapy also impacts osteoporosis. It impacts a lot of different things. So you want to be very focused. And again, no judgment. If you don't want to do hormone therapy, you don't have to. It's up to you. And it's up to how you feel and how your body feels. But have that conversation with your physician or your nurse practitioner and see what you can do. Because after all, we are alive for a reason. There are only a few species in the world that have women, the female, once they get into menopause, actually survive. So nature must have determined there was some reason why we menopausal women and postmenopausal women are still around. So this is Diana Devi. Subscribe, and I will see you again on our next topic. Bye for now.